Hi everyone, I'm Cristina Moglia and I talk you about telemedicine experience of an Italian ALS center during COVID-19 pandemic. During the COVID-19 pandemic, Italy has acted a national quarantine. Since only urgent hospital visits were exploited during this period, we had to move most of the assistance to telemedicine. And here I described our experience of telemedicine with ALS patients during the pandemic. All visits scheduled between 6 March and 6 April 2020 were considered for telemedicine. Patients were asked about general conditions, specific ALS symptoms and signs, and most common COVID-19 symptomatology. The ALS-FRS scale was also collected. Patients were still able to telephone, being put through directly to their neurologists. And a few days after the contact with the center, patients and caregivers were surveyed to assess their satisfaction with the service received. A total of 144 control visits were scheduled during the study period and mostly consisted of neurological and psychological visits. 139 visits were performed as telemedicine and mostly via phone call. Many requests of contact were addressed at getting information about the scheduled visit or examinations. Globally, patients and caregivers consider themselves satisfied of the telemedicine service. However, 2/3 of respondents would have preferred an in-person visit. And respondents who would have preferred an in-person visit did not differ from those who would have preferred telemedicine. So, in conclusion, our experience supports the possibility of applying telemedicine for ALS patients follow-up. Most patients and caregivers would have preferred an in-person visit. This could be related to the peculiar physician-doctor relationship in ALS, including also a variety of ethical, social, and psychological aspects. Thus, telemedicine for ALS patients should be intended to be complementary to in-person care and only in some cases to replace it, depending on circumstances and patient preference. Thank you for your attention.